So, hello everyone. My name's Melinda St. Louis, and I'm the Director of Public Citizens Medicare for All campaign. I'm really pleased to welcome you to our monthly Coalition Medicare for All Resolutions webinar. We're meeting tonight in very challenging times for our country. There is no doubt about that. The incredible organizing and protests that have been led by Black activists over the past few weeks have urged a real reckoning to confront systemic racism in all facets of our society, from racist policing to a racist healthcare system that devalues Black lives. And we know that the Medicare for All movement really needs to be a part of that reckoning. And so that's going to be the focus of our webinar tonight. We have leaders from our coalition who are experts in confronting racism and who have experience centering racial justice in the work for Medicare for All, and they'll share insights and experiences and ideas of how to continue this work going forward. We have a really exciting panel of speakers from the NAACP, and from People's Action, Center for Popular Democracy, as well as the Knoxville City Council member Amelia Parker will be joining us, and local activists from around the country. As always, you can please write in the chat where you're from, and if you have any questions or comments, and we will be able to address those. The panelists can address those in the chat. If you've called in, you can send questions to medicareforall@citizen.org, and we will try to answer those questions in the coming days as well. So if we don't get to your question, we will pay attention to them and do our best. So I'd like to turn it over now to, we're really lucky to have Dr. Sanjeev Sriram, aka Dr. America, who's a pediatrician and who's served in Southeast DC, and he leads Social Security Works All Means All campaign. He'll be co-leading tonight's discussion. I really appreciate that. So I'll turn it over to Sanjeev to help frame the discussion before we get started.
Yeah, thanks, Melinda, and welcome everyone. So glad to be co-hosting this webinar on such an important topic at such an important time for our country, just like Melinda was saying. So at the All Means All campaign, I founded it at Social Security Works because the more I got to know the Medicare for All policy and the more I got to know people in the movement, I felt that that racial justice and equity was missing from a lot of the conversation. And more importantly, I felt that the policy needed to be centered on racial equity, given the demographic changes that are going to be happening in this country and that have already happened in many parts of this country. So what I'm hoping that we can do tonight is talk about how Medicare for All contributes to racial justice, and also where it runs into limitations. I think that when a lot of people think about this topic, they immediately assume that, well, you're talking about universal health care, right? Isn't that like going to, doesn't that just build equity just by being universal? And I would say yes and no. I think that universality is a key component of Medicare for All, but there is a lot more to the policy that contributes to racial justice beyond just the universality, though that is a tremendous point. And over the course of tonight, I'm hoping that we can talk about how Medicare for All distinguishes itself as a policy and as a movement in building racial equity in ways that perhaps other policies that claim to be universal health care might fall short on racial equity. So I'm really excited for tonight's panelists and from the people that will be speaking with us. And yeah, I'm looking forward to a really robust discussion about where Medicare for All and racial justice meet.
Great, thank you so much, Sanjeev. And now I'm really thrilled to invite Hilary Shelton, who is the Washington Bureau Director and the Senior Vice President for Advocacy and Policy of the NAACP, who advocates for the federal public policy issue agenda of the oldest and largest and most widely recognized civil rights organization in the United States. The NAACP helped to organize a letter last year among prominent civil rights organizations explaining why Medicare for All is a racial justice necessity. And so we're really grateful, and thank you so much for joining us to share insights about this moment and what you think it means for healthcare justice advocacy. Welcome, Mr. Shelton.
Melinda, thank you, thank you. It's an honor to be with you all. I'm a little intimidated whenever you come behind the doctor. It's hard to give the kind of data and information you did, but doctor, you did a wonderful job. Thank you so much for setting us up the way that you did for this conversation. Let me also say that you can imagine the NAACP is the United States' oldest and largest grassroots-based civil rights organization. That means we have about 2,200 membership units, and we're in every state in the United States. We're still on military bases in places like Italy, Germany, Korea, and Japan. But interestingly enough, when we have the conversation around healthcare, we don't get the complaints from those countries. The complaints and challenges that we have are those that happen right here in the United States. Different systems work better in many ways for them that I would even argue. Just as a little background, as we were working on what became the Affordable Care Act, I get a lot of visitors from all over the country. And particularly at that time, I had a group of college students come in from England to spend a little time in DC, and they wanted to talk to us about civil rights issues and the like. You can imagine we were hot and heavy on the issue of health care. President Obama's bill was moving forward, lots of discussion. We were having some challenges along the way. As I rushed into my office from meetings we had on the Hill about the bill, I saw them all there bright-eyed, ready to talk about various issues in the United States. But they sat there and they were very thoughtful, very courteous as they listened to me do an opening, explaining what was going on, the work that we do in the United States, and a little bit about the history of the NAACP. As I wrapped it all up, I said, I know because we're an African-American organization, you'll probably want to talk about the first African-American president of the United States and what's that like. You'll probably want to talk about the challenges of civil rights concerns in the U.S. and, of course, the concern around healthcare, as we're debating that very hot and heavy. So with that, listen, I'm going to ask you some questions, but now it's your turn to ask me some. And they all sat and they smiled a little bit, they nodded their head, and then finally one of them put up his hands and said, sure, what's your question? And he said, on the issue of healthcare, what took you so long? The issue for them as they raised the concerns was they recognized that in the United States at the time we were entering that debate, we had almost 47 million Americans with no health care insurance. That indeed we had those that were struggling along with some piecemeal government programs as they were, but nothing to truly take care of them in a comprehensive way. We weren't talking about preventative care at that time and other issues we know that are important to us as we think about ways of preventing problems. And of course, when someone becomes inflicted, ways to be able to solve those problems and address their illnesses and whatnot. So as we talked about it for a minute, it hit me. They didn't have that problem in England. In England, if you're born there, you get insurance. They didn't have that problem in Germany. Someplace I'd just been a couple years earlier, the same thing applied. And other places too across Europe. But for some reason, we allowed those who are more interested in, quite frankly, profit lead the way. Let me also say, as I set the tone for our discussion about Medicare for all, is that I will always remember as we were going through those discussions, between the various insurance companies, healthcare providers, and others that wanted to protect their economic interests, they'd hired the equivalent of 10 lobbyists per members of Congress. And for those who you may not be familiar with what that means, as you think about members of Congress, you're thinking of, on the House of Representatives side, 435 voting members. You're thinking of 6 non-voting members. You're thinking about 100 members of the U.S. Senate. But you're also thinking about men and women on both sides of the aisle that have the Rolls Royce of healthcare programs and healthcare insurance. And as such, I thought it was very, very interesting that one of my friends on Capitol Hill with the Congressional Black Caucus said, I have an idea to fix this problem. Let's extend the same healthcare plan that we get here in the U.S. Congress to the rest of America. Well, needless to say, I like that idea as we look at those issues and those concerns. I thought it would be great if we set up something like that and then realize what they were really talking about. If you look at just the Congress itself, they really had Medicare for all. In essence, they had the best insurance plan that anyone could possibly have. And I started thinking about it a little bit more. I started thinking about how, if we looked at those that we went to address the problem, the first bill that was up was actually, even though they didn't call it that, was a Medicare for All bill. And I remember us having that fight on Capitol Hill to try to get it through. And I remember it being defeated. And we went to my friend Harry Reid at the time, the majority leader in the Senate, and said, look, so we got to do something. We still have a problem. He said, look, we've got a second plan. We're going to bring him up. So he had to change his vote so he could bring another plan back up, though he had supported initially that particular plan. The second plan was a public option. A public option means that basically many people could keep your own insurance if you want to, but the federal government will provide insurance for those that for one reason or another don't go with the private plans. A balance and whatnot to try to offset things and so forth. Interestingly enough, the Senate shot that one down as well. So we went and sat down with Harry Reid one more time and said, look, we still got to do something. So we got a third plan we can look at. After we finished looking at it, talking about it, we realized what we were having was actually the Massachusetts plan, which is what we have in place now. A plan that very well provides the kind of supplement and the kind of, you've seen the groupings of health insurance plans that help people find the most affordable plan for themselves. But we also realized, even as it was successful to a point, and it was to a point, we were able to reduce the uninsured from that 47 million down to about 23 million. Well, that was good, moving in the right direction and whatnot. But then, like so many other things in the political arena, we had an election. And we went from those that supported healthcare and expanding healthcare to somebody that absolutely didn't. And that's the man that lives at 1600 Pennsylvania Avenue right now. So as we're thinking about this issue, Medicare for All makes sense. It makes sense because we've seen it played out in other countries where people are insured. It makes great sense. It makes sense because we've also looked at what happens when people don't have it. And we look at the medical debt rate in the United States of America as well. The millions of Americans, as a matter of fact, what we found is about over 137 million Americans suffer from medical care debt in the United States of America. And if I think of those from my own community, the African-American community, there are about 3 times more African-Americans that have medical debt than anyone else in the United States of America as well. Let me stop there and just say, we need to move to address what's in the best interest of the overall people of this country. We know we have those that think that if we fight against medical programs like this, perhaps, and I'm talking about the richest of the rich, they were able to save money on their own taxes because they don't care about anyone else. They can pay for their own insurance if they can save that money and not having to pay anything out in their taxes. As I think about other challenges, we know that medical debt, even in other places throughout the United States, have actually put many people out of their homes, foreclosed upon their automobiles, and other challenges along those lines as well. The bottom line is this. We've watched what happened with a healthcare system that was just a little bit worse than the system we have now. But however, we're also talking about a healthcare system that can sway with every election and the president of the United States, as we've seen in this. So we want to make sure that we're fighting for a healthcare system that will make sure every single American has a right to have care, to be able to go see their doctor, set up a plan to prevent illnesses and other problems. And when they get sick, we take care of it a lot sooner. Overall, we will save an awful lot of money, time, anguish, and human lives as well in our country. It's time for us to talk about putting in place a Medicare for All system.
Thank you so much, Mr. Shelton. We really appreciate the leadership of the NAACP on this issue and so many others. And we, again, thank you so much for your leadership. If you want to look in the chat, it looks like there were some questions for you if you want to answer them in the chat. But again, thank you so much, and we will we'll stay in touch. Yes, so now I'd like to turn it over to Connie Huynh, who is the director of People's Action Healthcare for All campaign, to share some about how they have been centering racial justice in their organizing. Connie?
Thanks, Melinda. Hey, everyone. So as Melinda said, my name is Connie Huynh. I'm the Healthcare for All campaign director at People's Action. We are a network of community-based organizations that are fighting for a Medicare for All system and also to disrupt pharmaceutical monopolies. So that's the short version of it. And I'm really glad to be here tonight to be able to talk about how we are shifting our work. And I actually want to sort of reframe this and want to talk about this according to like 3 critical questions that we should be asking ourselves as a movement. So beyond People's Action, as a Medicare for All movement, you know, I think it's really clear in COVID, right? Like we absolutely see what happens to everybody when Black lives are not centered and Black lives are not valued, right? And so in this moment, People's Action as a organization that is organizing across race and class and geography, we are answering the call to center Black lives, right? And we see that because we haven't, the reality we're living in is that there are disproportionate rates of death amongst African-American and Black men. And that has allowed corporations to effectively push for reopening our economy too soon and ineffectively, right? And so we see how race is sort of like, and the value of race sort of gets used as a wedge to justify reopening in a way that impacts us all. And so I want us to imagine, what would the response be if Black lives truly did matter, right? To our electeds, to our neighbors, to us as a movement, right? And I think we know that the response would be a moral outrage, right? That this would be absolutely unacceptable. And then we absolutely have to create a plan and policies aimed at preventing disproportionate death amongst Black people. And what would that look like, right? It would include healthcare coverage, a very basic thing people will need in a pandemic. It'll include access to culturally competent care. It will include a guaranteed vaccine, right? But it also go beyond healthcare and would include shelter and housing, income security, cancellation of debt and utility bills, a Just Jobs program. All of these things are factors that contribute to the disproportionate rate of death in the Black community, right? And so our response would be colossally different. And so that would be a new reality for us. And in our current reality, we have to ask ourselves, whose needs are we centering right now? Right? And that's, of course, the 1%. That's why we're here. Right? And so as we look ahead at the Medicare for All movement, I think it's also really important for us to assess and ask ourselves, you know, how do we become a movement that reflects what we've been saying, right? Dr. Sriram's campaign is all means all. So how do we as a movement reflect that? How do we embody that? And he's right, we can't reduce this movement to universalism, right? So often I hear, you know, this Medicare for All is good for everybody because it covers everyone, and that's it, and everyone needs to accept it. But that's not how this works. And in order to actually win Medicare for All, we're gonna need everybody on board, right? So we can't reduce it to universalism or costs or statistics, right? Black people, our allies, have a place in this fight and a stake in this fight. And as a non-Black ally, I know that I benefit when we center the experiences and follow the leadership of Black people as the authority of their own lives and how they experience our healthcare system, right? And so we need to take a hard look at ourselves as a movement. We need to talk with our allies. And we need to ask, do you see yourselves reflected in this movement? And if not, or if so, why? And if not, why not, right? And the irony is, if you look at the platform of the Movement for Black Lives and are listening to the demands that are being released, healthcare is a top demand, right? Black people have been fighting for survival, for health, for decades, and some would argue centuries, right? And we actually have Medicare as a program because of Black activists and doctors, right? So for us to expand it, like, we have Black activists to thank for that work and for the program. And so it's up to us to figure out, you know, how we build with Black people and leaders and follow their leadership in this moment. So I'm really glad to be here and like have this discussion with you all, but just sort of wanted to make sure that as non-Black allies, we are also assessing sort of what our role is in the movement.
Thank you, Connie. That's absolutely right and really important words. So thank you so much. And thanks to People's Action for all you're doing. Now I'd like to turn it over to another really important coalition partner in this fight. Vinay Krishnan is the National Organizing Director for Center for Popular Democracy, which is doing incredible work across race and class as well. So welcome, Vinay.
Thank you, Melinda. Thanks for having me. I'm the national field organizer, not the director, but I understand the confusion because we have like 30 directors at CPD, so don't worry about it. So when I saw the guest list tonight and I saw all these brilliant minds talking about Medicare for All, I knew the racial disparities in Medicare for All would be covered very articulately by people who are much smarter than me. So I wanted to focus on some things that CPD is doing to kind of respond directly to this moment we're in, to respond to what's going on with these protests, this mass movement, to what we see on the streets every day. And especially as that relates to healthcare, we run a drug pricing campaign, an opioid campaign, and a Medicare for All campaign at CPD. So obviously, as I'm sure all of you did 4 weeks ago, you sat down and said, well, okay, well, how do we continue this work while plugging into this movement? And I think it's just so clear the connection between what's happening and the work that we're doing right now. And I want to talk a bit about harm reduction in particular, because so much of what we're seeing on the streets, the militarization of the police, is directly related to the drug war. And of course, that has racial disparities as well. And so much of this police power grew during the drug war and grew because of the criminalization of Black behavior. So when we talk about racial justice, when we talk about the overdose crisis, it's inherently tied to the movement for Black lives. So at CPD, we've been kind of trying to imagine what would harm reduction look like without police, because currently we have first responders not responding to overdose because of COVID. We have, Good Samaritan laws being overturned and people not even wanting to report overdoses because they're afraid of being involved in the criminal justice system. And another aspect of this whole era is you talk about looting, right? We're seeing so many examples of individual acts of looting, and fewer talk of the kind of systemic policy-wide looting that takes place through fines and fees, through civil asset forfeiture, through redlining. And again, it's all connected right to the drug war. And we're exploring solutions to this problem with our healthcare work. And of course, Medicare for All, in a way, is harm reduction work. It's a reallocation of power to people who are most vulnerable to state violence. And we're plugging Medicare for All for those reasons also. And I also wanted to point out that this week, I think actually today or yesterday, Senator Tina Smith and Senator Murkowski unveiled legislation to devote $50 million directly to harm reduction, which is the only COVID bill that does that. And Senator Tammy Baldwin is sharing a sign-on letter to also do the same. So those are really kind of important efforts that are going on. It's directly tied to Medicare for All, but it's kind of tangential a bit, but I wanted to lift that up. And the second area I wanted to lift up is mental health care also, because that is so important to the Medicare for All discussion and so important to remove the barriers to care, especially those that disproportionately affect minority communities and Black communities. And I had a meeting today, which I'd love to tell you about. I met with Senator Toomey's office. I don't know if we have any Pennsylvania residents on the phone, but I'm sure you're familiar with Senator Toomey. And we were talking about these issues. We were talking about healthcare. We were talking about the Healthcare Emergency Guarantee Act. We're talking about Senator Warren's COVID-19 Emergency Manufacturing Act and other bills that CPD is supporting. And I brought in a constituent, and he told a mental health care story. And he told his story, and he specifically asked for Medicare for All as a solution to that story. And Pat Toomey's healthcare advisor, his response was, it was a story about suicide. And his response was, you know, the thing about suicide is it's untreatable. There's nothing to do about it. There's no way we can solve that problem. He literally said it's impossible. And I just tweeted about it. His quote was, I wish I had an answer for you. And it's just remarkable to me that a healthcare staffer for a sitting senator does not understand that you can treat suicidal ideation. And I wanted to tell him, for those of you who know me well, you know I do lots of mental health advocacy. I wanted to tell him that I was literally treated for suicidal ideation 3 months ago, and it was completely successful. And now I'm healthier than I've ever been because I'm privileged enough to have health insurance, and so many people aren't. And I wanted to make that point, but they very abruptly ended the meeting 20 minutes before they were supposed to and left, so I couldn't make that point. So that's clear evidence that we have lots of work to do. We have lots of minds to change on Medicare for All, on harm reduction, on mental health care, and it's all directly tied to this movement for Black lives. And I know lots of people have been stressed out over the last 4 weeks. They've been saying, you know, this is the hardest thing we've ever done. This is, you know, so much. Lots of people have had negative responses to it, but my response was always like, the work we're doing right now is not a burden in any way. This is like an opportunity. Like, we are not cursed with these enemies and obstacles. We're like blessed to be alive doing this work in this moment when we can like actually transform America. So I'm really excited to do that work with everyone on the call. Thank you so much.
Thank you so much, Vinay. And now I'll turn it back over to Dr. Sriram to share a little bit more about the work that he's been doing to center racial justice in our Medicare for All work.
Thanks. So, you know, at All Means All, we learned that nationally, 59% of America's uninsured pre-COVID were people of color. And since the economic devastation of the pandemic, that number and those figures have likely worsened. Also, we have fact sheets for every single congressional district and the states that show racial disparities in coverage. I'm just going to put that link to that in the chat so that people will have it. But what those fact sheets show is that state by state, this narrative of inequity in healthcare, especially when it comes to coverage, varies dramatically across the country, but the unifying theme is that there is not a single corner of this country where it is not a racial injustice to be uninsured. You know, a lot of eyes have been on Minnesota over the last several weeks, and what we find there is that people of color make up 21% of the general population. They make up 44% of that state's insured. And that's in a state that has been relatively friendly to the ACA and its provisions, with expanding Medicaid and operating an exchange. And you know, it's not a poor state. They have, you know, I mean, 16 Fortune 500 companies have headquarters there. It is not a poor state at all. And so, you know, I mean, what I found important to ask about every single one of these states is not just to, you know, I mean, figure out like, well, what is their picture like, but to also get to these questions of why is this happening? Why do you have a majority minority uninsured population when the rest of the country is not there yet? Like, that is going to be our future, to be majority people of color, but that is not our current status as a country as a whole. And so what we find is that, you know, the reasons for why this disparity happens is because we have unjustly tied healthcare to employment for decades. And yet we have also decided that certain forms of employment are not worthy of healthcare. That we have decided that certain, you know, jobs that we are now learning are essential are still yet somehow expendable when it comes to healthcare. And even in the ACA, we have allowed a lot of companies that can afford to do healthcare for every one of their employees to get away with not doing it. There are a lot of large employers that are skating the rules by cutting a number of hours, not letting employees sign up for extra hours, because the moment more hours are accrued by workers, the more that they are going to then get closer to qualifying for healthcare benefits that these companies don't want to deliver. And so you end up in a state like Minnesota where 90% of the uninsured are working. And so work is no longer a means of acquiring, and it should never have been, a way of acquiring healthcare. We're also finding, and yes, Medicare for All ends that because it says that regardless of what you do for a living, or not, you still are eligible for healthcare. Your eligibility is your humanity. Your humanity is your eligibility. That is the simplicity of eligibility in Medicare for All. Another aspect that I found fascinating with, doing this work for All Means All is to also understand that why is it that in the part of DC that I work in, Southeast DC, hospitals and clinics struggle to stay open. Those hospitals and clinics don't struggle to stay open in Foggy Bottom and in Georgetown, which are the wealthier, wider parts of DC. And yet we are one small city, and yet we have these huge disparities over where hospitals stay open. And this is an aspect of Medicare for All that, is actually rectified, that hospitals don't struggle to stay open based on where they are or who they serve under a Medicare for All system because of global budgets. Now, so far, our understanding of the policy, we've never really connected global budgets to, ending, that disparity, but that is a huge part of how Medicare for All will build racial justice is by actually strengthening the financial stability of clinics and hospitals in places that need them the most. And, the final thing that I see as an important part of Medicare for All that makes it different compared to other policies and programs that claim to be universal health care is that the coverage is portable. It is mobile. You move across the state line because, economic hardships require you to be closer to family, or because you discover a new, job opportunity in another state. Your healthcare coverage moves with you. You decide that, with the extra time that you have with being unemployed, maybe now is the time to pick up an extra certification, an extra licensure, maybe get a little bit of extra training in a skill that you've always wanted. Making those kinds of personal financial decisions no longer impacts your eligibility for healthcare under Medicare for All because your humanity was your eligibility to begin with. Whereas with our current fragmented system, the slightest change in your personal finances and you will no longer be eligible for Medicaid, but you might not be able to afford the private insurance available on the exchange. And depending on where you live, you might actually not even have that option. You might be in the coverage gap where you earn too much to, qualify for Medicaid, but not enough to get subsidized coverage from the exchange. And so, for all of these reasons, Medicare for All is actually contributing to racial justice in ways that are beyond just the universality. And that I think that if we, as activists, when we talk about Medicare for All, we have to start looking past universality because we are up against other policies that are claiming to be universal but really aren't, and also do nothing to address any of these issues when it comes to how do hospitals stay open? How do you, how do you change jobs or go through a new chapter of life like graduating from, school to new job and not lose or have, question marks about healthcare? And so for all of those reasons, Medicare for All is actually contributing to a peace of mind that people of color, when it comes to healthcare, have never had before. And then the last thing I want to say is that Medicare for All is not fixing racism in healthcare. We have to be very honest about that there is going to be a ton of work for us to do after, we pass Medicare for All. And I would say that we have to be working in parallel to continue building, a more racially just healthcare system. And, so these are the dimensions of the conversations that we should be having about Medicare for all. I think that, COVID-19 has exposed what have been longstanding truths. Like a lot of what COVID-19 has exposed is not new to the people who have been suffering, with these inequities, but they have become a lot harder for people who are not suffering with them to ignore. And so we have to understand, how is our policy going to rise to this moment? And how are we going to make sure that our political leaders do so as well? So that's what the All Means All campaign has been working on. We're happy to partner with you, and I'm happy to take any questions that come up in Q&A. But thank you for the opportunity.
Thank you so much, Sanjeev, for your very clear leadership on this issue. I wanted to note, you should put in the chat your your data by congressional district, because I think there's some folks who are interested in those fact sheets that you have as well, which could be really helpful. So thank you so much. I want to thank all of our amazing national experts. I now want to turn to the local level to hear about some recent local organizing successes in these challenging times and the importance of addressing racial health disparities and fighting for racial justice at the community level. First, we're really thrilled to have with us folks from Knoxville, Tennessee. We're thrilled to hear about the exciting organizing victory last month. The Knoxville City Council passed a resolution in support of the Healthcare Emergency Guarantee Act and Medicare for All. We'll hear from Knoxville activist Noah Nordstrom, who will introduce Councilmember Amelia Parker, who championed the resolution. We're so grateful to both of you, and especially for Councilmember Parker for being with us tonight. Noah.
Hi there. My name is Noah from Knoxville, and I won't take very long because Councilmember Parker could tell you the story a whole lot better. But my role in what happened was basically from the standpoint of digital organizing, and it was actually putting the constituent who we had met during the election. She ended up making all these "We Need Medicare for All Now" masks around town, and she was kind of building this hype around it. So we were able to partner with her, and she let us use some graphics of different folks that she had made those masks for, to show that there was a lot of local support for Medicare for All. And we turned that into a social media graphic that got a lot of traction, and there was a lot of public pushback, or not pushback, I should say, public push for passing this resolution. And I think that's ultimately what helped make it really successful. But yeah, to tell you a little bit more about it, I want to introduce to you Councilmember Amelia Parker.
Thank you, Noah. And thank you, Melinda, for the invitation and for organizing this space with so many brilliant minds. I will be brief as well, but for Knoxville, it was all about timing. In our state, we had a conversation happening about the need to expand Medicaid, and we're one of the states who has not done that. And there was growing support, from both Democrats and Republicans to move forward with some sort of Medicaid expansion. And so one of my fellow council members was introducing a resolution in support of expanding Medicaid. And I thought that it was a good opportunity to expand that conversation so that we could talk about how many would not be covered. If we expand Medicaid in Tennessee, we are able to cover another 300,000 individuals, but far from ensuring access to healthcare for all. And some of the same arguments that were being made to expand Medicaid are, of course, relevant for a Medicare for All resolution, which is we have, over 17 rural hospitals that have closed down throughout the state. We're seeing, an increase in the burden on our emergency health services in our cities. We're seeing an increased burden on our municipal budgets from the increasing cost of healthcare. a lot of these, and also, of course, more people are aware of that injustice of having healthcare tied to your job when during a pandemic, we're not able to have the resources we need, you know, to ensure care for all of our residents, because many are losing that healthcare coverage by losing their jobs. So a lot of it was about timing for Knoxville. Folks are seeing this issue in a different light because of the pandemic, and are honestly surprised, but willing to engage in conversations that take us beyond just expanding Medicaid in our state. And I felt like it was important. I didn't know if the resolution was going to pass, and I was very happy that it did. But I felt like in a red state like Tennessee, when we have you know, a more progressive city governments, and we have many residents who are calling for Medicare for all, that we use our voices to represent our constituents, and to you know, add our voices to the calls that are happening nationally, that are often, you know, by many of our political leaders depicted as coming from either the East Coast or the West Coast. That's where, you know, the folks who want Medicare for all are situated, when actually they're throughout our country, and their voices need to be lifted up. And I felt like this was a good time to do it. And so I was really proud of my city and my city council for joining me in supporting the resolution and passing it. We passed our resolution on May 19th. And I also have to give thanks to New Orleans for you know, I know other cities have done it, but their recent passing of their resolution came across my desk, and I used a lot of language from the New Orleans resolution, and also the Medicare for All resolutions website to draft the resolution that I introduced. And so that initiative in Knoxville would not have been possible without others, you know, taking steps before us. So I appreciate all the work that has been being done by so many that we were able to, you know, use in order to move this effort forward in Knoxville.
Thank you so much. It's really inspiring, and I think especially, I think it made a real splash nationally, not just in Knoxville. You know, for Tennessee, to, you know, a city in Tennessee, in a very deep red county in Tennessee, to be taking the stand. And I'm not sure if you know, but actually just on Monday, South Bend, Indiana passed a resolution in support of Medicare for all, and they pointed to the Knoxville resolution as part of their inspiration to do that. So it's multiplying, and it's really exciting. And I know that there are folks in Nashville who want to try to follow suit as well. And so thank you again so much for doing that, and we will do our best to continue to amplify the great work that's happening at the local level. And thank you again for your leadership, Councilmember Parker. And you can see in the chat there's a lot of kudos and excited comments about what you've just said, so thank you. Next, I want to turn it over to another local activist, Barbara Fichtenberg, I hope I pronounced your last name correctly, who helped to lead a successful resolution in Pittsfield, Michigan, also just a few weeks ago. Barbara.
Yes, hi everybody. Pittsfield is just south of Ann Arbor, Michigan. And we have a fairly diverse community here. About 1/3 are non-Caucasian. And I've been on this distribution list for Medicare for All, but I hadn't decided whether or not I had the motivation to take any action on it. Then in mid-May, I received a community letter from our township supervisor, and she started sending these emails during our weeks of lockdown, their weekly emails. And her letter focused on the ways in which she and the county sheriff had been working together to address social justice issues. They had participated in a panel discussion about how the great pandemic is highlighting the existing socioeconomic and racial divisions in our county's communities. She and the sheriff expressed their recognition that the pandemic was providing an historic opportunity to rectify inequities. She issued a call to the larger community to support them in taking bold and courageous steps. After reading that letter, I just knew this is the time to act. So I sent her an email stating my gratitude to them for taking such issues seriously and asked if the township would consider a resolution in support of Medicare for all, as Ann Arbor had recently done, attaching a copy of Ann Arbor's resolution. Well, she responded almost immediately, thanking me for the recommendation and saying she would craft a resolution and present it to the board. There was a slight time delay, but it ended up being presented on June 10th, and happy to say that it passed unanimously. She emailed me the very next day to let me know, saying that she had had input from other residents in the community saying that they supported the resolution as well, and offered to forward it to all the federal and state legislators, and thanked me again for my initiative and partnership. So I think in retrospect, I learned that it's very important to pay attention to what your community leaders are saying and finding a way to connect your desired outcome with their views. And that seemed to work pretty well.
Great.
So.
Yeah, no, that was really exciting. Thank you so much, Barbara. And I hope it's inspiring to others as well to jump in. We really are seeing a lot more interest. And I think what Councilmember Parker said, this is the time, you know, this is a timing moment where we can really move this forward. And we're really seeing that happen. It's very exciting. And I'd like to also now invite Anna-Marta Visky, who is with Our Revolution, a local organizer in New Jersey with Our Revolution, to give a quick update about the work that they're doing in New Jersey, which is also super exciting.
Yes, hi Melinda. Thank you for inviting me on this wonderful panel. I'm organizing, as you mentioned, for Our Revolution, New Jersey, and my home district, which is CD6. I'm represented by Congressman Frank Pallone, who is the chair of the House Energy and Commerce Committee and one of the most powerful Democrats, and one of the Democrats who is blocking right now the passage of Medicare for all. So we have our work cut out for us. We have started pressuring him end of 2018, but really solidly at the start of 2019 in January. And since then, we have been hosting steady actions from a simple letter writing campaign to postcards, to calls to his office, visits to his office, to meetings with his legislative directors, rallies, protests, bird dogging, very effective bird dogging. There are some videos up on our Facebook page, and it's very revealing what he stated in one of our videos, which is on our Facebook page. He said that Medicare for all cannot pass because there are vested interests who will oppose it. Can you hear me now? Can you hear me now?
You cut out for a second, but I think we can hear you again.
Can you hear me now? Yeah, that's my problem with the internet. All right, so anyhow, bird dogging with Frank Pallone was very, very effective, and I recommend it to every activist group or movement group or organization. In one of our bird dogging actions, he revealed that one of his reasons why he thinks that Medicare for all will not pass is that vested interests will oppose it. So obviously, looking at his campaign donors, we understand who those vested interests are, and we are calling that connection out. He also mentioned that he doesn't think that Medicare for all can pass because the votes are not there, which now with the New York victories on Tuesday, we are adding votes to Medicare for all in Congress. We are very happy about the victories that happened in Tuesday. We are crossing our fingers for Booker in Kentucky, and here in New Jersey, part of our mission statement and part of our theory of change is organizing for progressive candidates who actually believe in our values and winning progressive issue fights. So for the past month, given that it's New Jersey primary, it's underway, we have been intensively getting out the vote for vocal Medicare for all supporting candidates, and many incumbents in the state in many critical districts are being challenged by credible and competitive progressive candidates who all support Medicare for all, which is huge. So that's what we kind of have been focusing on lately. And as soon as July 7th, which is our deadline for the vote by mail primary passes, we are back on fully organizing on our issue campaigns and Medicare for all. Part of that is passing a resolution in Red Bank. Similar to all these wonderful local Medicare for all resolution actions. We have a majority Democratic council in Red Bank. And Red Bank is a diverse town where we have a large undocumented population, our sisters and brothers who don't have insurance and are also not covered by any public benefits, are not eligible. So we have so many people that we are fighting for, and that's part of our resolution, of course, focusing on that segment of the population, also on the frontline workers who are disproportionately affected and uninsured as well. So we are organizing heavily for it. We created a petition. We are collecting signatures. We have met with council members who are supportive. We have met with even a state senator who expressed his support. So right now we are basically gathering signatures. We want to gather a couple of hundred to present to the council, and we are hoping that it's going to be introduced at the next session. Next council meeting. So that's kind of it for us in a nutshell. But yes, Frank Pallone, and hooray for progressive wins in the New Jersey primary.
Thank you, Anna-Marta. It's really been really inspiring to see what a thorn in the side of Frank Pallone you all have been, and it's really important because he has such a, as the committee chair, just has such a high profile position. So thank you so much. So this is just, just a snapshot of the amazing organizing that's happening all over the country by local officials and local activists. And we're just so grateful to all of you. And we've even seen about more in the chat that is happening. And so I want to thank everyone for their insights. I mean, what's clear is that addressing the racism that's baked into all facets of our society, and especially our healthcare, must be a priority for our movement. I just recently was reading a book by Ibram Kendi, who explains there's really no race-neutral policy position in healthcare, really in anything. There are either racist policy and ideas that perpetuate inequality among the races, or there are anti-racist policies and ideas that promote equity. And so we really need to continue to work to challenge the racist ideas and policies in our healthcare system, as well as in our own work and in our own organizations, that I think Connie also really importantly challenged us to do. So before we close the discussion, I'd like to just ask our panelists and also our resolutions campaign organizer, Brittany Shannahan, is also with us. Any final ideas of kind of concrete ways that you think we can or should center racial justice in our organizing for Medicare for All in our communities? So if Vinay or Connie or Sanjeev, Councilmember Parker, if you have any kind of concluding thoughts, kind of based on things that you saw in the chat, we have about 5 minutes. Would love to just hear a minute or two from each of you, some concluding statements, but really thinking about what are some next steps that we should all be taking. Connie, would you like to start?
Sure, I can start, and I am by no means an expert or anything, and I don't think any of us really are, but just in terms of like how I approach the work, I think there are some like fundamental do's and don'ts, like missteps that we make that we can avoid making. And I think like one, as organizers, we are really good at listening, and I think we need to continue to exercise that. And I think we need to recognize that not everybody's story is the same. And I think in particular for people of color and for Black people, there is like historical trauma associated with our healthcare system. So like, you know, fundamental access and coverage to the healthcare system is like a basic step that we need to take. But there is just so much that we need to overcome in terms of racism within our healthcare system. I think folks are familiar with what happened through the Tuskegee Institute. We know about forced sterilization of women of color. And then, you know, as we've noted in the chat, Black maternal mortality rates are really high. So all of these things also contribute to like a level of skepticism that we really need to like be mindful of as we talk and think about building a just healthcare system. And then I think like we also need to look around in our community. Like there are, again, like people have been organizing for their healthcare and for their health and their survival. And we should look within our community. Maybe it's not who we typically would recognize, but like there are people who are already doing this work and Black leaders who are already doing this work, and we should connect with them and find out what it is that they're prioritizing, right? And figuring out how we sort of work together and build together. And so I think this is a push for us to like really act differently in our organizing. You know, it's not a plug and play model where we can sort of like pull the talking points and then use those in our organizing. Like we really need to have to change the way that we're organizing. And I think also just like, as much as I'm saying, you know, about encouraging us to think differently, I think it's important for us to think about the details and how we are organizing, right? Like, how are we engaging people? What time? What's the culture of our meeting? All of those sorts of things that are important, but then at the same time, not acting as if those factors are universal, but just like really being mindful of those things. So, I mean, yeah.
Thank you. Vinay, do you have any concluding thoughts around next steps?
Sure, am I muted? No, I'm not muted. Yeah, I do. So for an organization that's CPD, we have affiliates across the country and we're plugged into lots of local fights. So it was great to see lots of local organizers on the call. And I feel like one way to plug in to this moment in racial justice organizing through healthcare is through city budgets and through school budgets, and emphasizing the kind of a invest-divest framework and divesting from police and police-free schools, and working with your local city council to take money away from police and invest in the healthcare that we need, invest in statewide single-payer campaigns, invest in PPE in your state, in your city. And I think it's interesting that right now we're definitely involved in two of the defining crises of our lives, and they're both, one of the important intersections is schools. And if you look around the country, a lot of the places people have begun divesting from police are in schools. And so we're trying to invest in healthcare in schools, invest in PPE for school staff, invest in mental health care services for students, kind of pull the resources that way. So I think that's something people can get involved in all their communities, and it's directly tied to the larger healthcare fight. So that's something I would advise. And to give some examples, here in New York, we have people occupying City Hall right now, trying to affect the budget. We had our affiliate Lit in Milwaukee unanimously voted to vote for police-free schools. And the next phase of all of that is we're trying to get all these communities to invest in healthcare. So I think there's a through line between those campaigns, and that's a narrative we can all be telling.
Great, thanks. Sanjeev or Councilmember Parker? Sanjeev, do you want to go ahead?
Sure. So, you know, I totally agree on everything that's been said so far. You know, the only thing that I would also add is that to be really cautious about how there's I mentioned briefly about our changing demographics and how a lot of the national story is that, you know, America will become a majority people of color country in the year 2040. But that's actually thinking about 30 years late when you actually look at the demographics, because as of 2018, people of color were the majority in Hawaii, California, Nevada, New Mexico, Texas, DC, Puerto Rico. Maryland is on deck for becoming the first majority people of color state in on the East Coast. We were 49.5% of the population in 2018. And so a lot of centering racial equity in Medicare for All, it has to be a local conversation. It has to get granular to the state and city and county level, because this is where healthcare is experienced and felt, and this is where we create our sense of belonging or not in healthcare. And so I encourage people to get to know the histories of their state, the demographics, what their communities have been through, and what Medicare for All is addressing and not addressing in those narratives and histories of pain and disparities of power. And I think that the more that we can connect with communities on that, the more that there will be a growing sense of place and belonging in Medicare for All that has been probably missing for a long time in a lot of American healthcare.
Great. Brittany, did you want to say something, some concluding remarks?
Yeah, I mean, I wanted to start it off by saying that, like, I sit here in my wokeness due to the freely given emotional labor of numerous Black people who have taught me how to think. And I think that is like another space for like those of us who are white people or in positions of privilege to like recognize is that like we, the gift that's been given to us is that it has been work. People work hard to get us where we are. But that we've had some comments in the from Stephanie about trans rights, which I thought I think it was like really timely. There's so many things to talk about in this subject that we didn't get someone to come in and talk specifically on the experience of the Black queer community and healthcare in this country. I mean, I'll say just a couple things really quickly. The Medicare for All is about giving everyone healthcare. A very good friend of mine wrote a tweet and then deleted it because they got scared a couple days ago, saying it is a shame that we have to describe the care, like the healthcare that we want, as medically necessary in order to get it. And that is a situation we're in right now. But like this fight is about, Medicare for All is about guaranteed healthcare for trans people and not asking those questions about whether you really need it. It's ridiculous. And this movement has come a long way just in the last 3 years on that subject. But also just sort of going back to what Vinay was talking about, when you're talking about the movements to defund the police or police brutality and all these things, I would say if you want to hear the most, one of the most upsetting stories you'll hear about these intersections is if you listen to the interviews that are freely available. A friend of mine recorded them. Her name is Stephanie Mavronis, of Black trans women who experienced abuse at the hands of the Baltimore City Police. Many of these women were working streets because they needed to pay for their hormones. And like this situation is ridiculous in so many ways. But when you get to that level, when you see this case where people are criminalized in this country for infection of HIV, for sharing needles and things like that, you realize there is such a connection that does criminalize queer people and especially queer people of color on this issue. So I'm really glad that got brought up. We'll definitely talk about it more. And we've been doing a lot of the work with the queer community in our resolutions organizing, so.
Thank you. I want to recognize that we're after the hour. Is there anyone else, any other panelist who has any concluding thoughts you'd like to share?
All I would say, this is Council Member Parker from Knoxville, Tennessee. Keep asking challenging questions. Even when you have representatives who you feel are moving in the right direction, keep pushing them, because there may not be things that they've thought of that represent your experience. Keep pushing them. And also, if you are able to find an ally on a governing body, push them to introduce legislation, even if they don't feel like they have the votes. I would say in this climate, make people say no to it. if they're going to, because it's a really hard thing to do right now, because some things that were theoretical for a lot of people have now become very real to them. Other people's lived experiences that they've lived with for a long time are becoming very real to people who've never really been aware of it. So just keep pushing, even your allies, and don't be afraid to put things in front of folks that you think might say no, because in this moment they might actually say yes.
Thank you so much. I think that's a wonderful way to conclude this very inspiring and really important and challenging discussion. This is not the beginning, this is not the end. We know that this is ongoing work that we must continue to do, until we have healthcare for everyone, until there is, that everyone is treated with respect and dignity, and we're able to repair the centuries of racist policies in our country. So thank you all again for participating. I want a special thanks to Councilmember Parker for taking the time. We're excited about the momentum that continues to grow even during these challenging times with the recent victories we heard about tonight in Knoxville and Pittsfield, as well as South Bend, Indiana, just on Monday, earlier this week. And we know that many folks around the country are making great progress in their communities, and we want to support you however we can with resources and the toolkit that we have on the website, medicareforallresolutions.org. Please be in touch with us on how we can support you in your organizing. And we will plan to have our next webinar in late July, so look out for the information from us about that. Please let us know if you have ideas. We saw lots of ideas in the chat. We weren't able to cover everything tonight, but I think it's really important. We'll take lots of those things into account. And if you have updates on your organizing efforts that you want to share, please let us know that as well. So again, thank you so much, and thanks to all the attendees and all of your engagement during this hour. We really appreciate it, and we look forward to continuing this work with all of you. Thank you.